Kendimize veriyoruz da veremedik aynı.
Mă regăsit aici la Sănătate, fără frontiere, așa cum v-am obișnuit periodic alături de noi prin intermediul StreamYard, doctor de top din Turcia. Astăzi alături de mine se află domnul doctor Șahin Ulu. Domnia sa este profesor doctor specializat pe otorinolaringologie. Vă mai spun că activează în cadrul Göztepe Medical Park Hospital din Istanbul. De 5 ani de zile este șef al departamentului de ORL și ofițer de educație și administrație. A absolvit facultatea de medicină, este membru al Comisiei de Acreditare a Medicamentelor. În 2013 a terminat Universitatea Marmara, specializarea ORL și timp de 10 ani a lucrat cu normă întreagă la universitate, contribuind la formarea a numeroși medici și specialiști. Așadar, astăzi, alături de noi, este domnul doctor Șahin Ulu, căruia îi spun bună ziua, good afternoon, hello, can you hear me?
Hello, I can hear you. How are you?
Very well, nice to hear you, nice to talk to you. Okay, we'll start our interview, Dr. Șahin Ulu, with my first question. Which techniques do you use in your surgeries?
Generally, I can perform surgery with both closed and open technique. The type of the surgery to be performed varies depending on the patient's nose. The same type of nose should never be done to every patient with the same technique. Can you hear?
Yes, I understand you. So we'll talk today about rinoplastie surgery. Vorbim despre operația de rinoplastie, de remodelare a nasului. Tell me, doctor, please, how long does rhinoplasty take?
The duration rinoplasty surgery may vary depending on the intervention to be performed. Apart from aesthetic problem, there are also health problems in the nose, septal deviation, chronic sinusitis. If not, it may take 2 or 3 hours. Operation to shape the tip of the nose lasts shorter.
I'll ask my colleague to show us some images with your rhinoplasty surgeries so we can see the differences before and after the intervention. Tell me, please, in which cases should rhinoplasty be performed? You spoke about the aesthetic part, but also the health part.
Yes. In rhinoplasty can also be performed together with the septoplasty to make the nose breathe better in case of the nose surgery. Aesthetic problem that occur in a person or shape of the nose deteriorates as a result of trauma, or in cases of high septal deviation.
Tell me, please, when does the shape of the nose settle after a rhinoplasty intervention?
Due to the interventions problem after rhinoplasty surgery, edema occurs in the nose and around the eyes, which affects the appearance of nose after surgery, usually within 3 days. Exaggerated edema and swelling go down. 1 year after this operation, the nose gets exactly the appearance it should be. That is why photos taken after 1 year are important for rhinoplasty.
So the final result, doctor, is after 1 year from the intervention.
Yes, exactly.
Is it a painful surgery for the patient?
No painful surgery, painless surgery.
So no pain at all. Okay, tell me please, when does, in which technology opportunities do you benefit from as an oral doctor?
Rinoplastie during surgery, when necessary, a piezo device is used that works with endoscopic imaging methods or ultrasonic sound waves that we use a bone cutter. In this way, we can better evaluate the most posterior structures of our nose and, if necessary, open the blocked channels of the sinus. With the piezo device, we can make a very fine adjustment to the bones in our nose. And since we don't do bone crushing, bruises and swelling are also very minimal.
Okay, what should be the pre-evaluation of the nose aesthetic surgery?
It's very important that you tell your doctor who will perform our surgery about all complaints that lead you to this surgery. If you have complaints such as runny nose and headache, as well as problem that you want to correct from aesthetically pain, it will help our doctors to solve other problem in the nose area during surgery. Our preoperative evaluations and photo shots should be done in upright position. For this reason, in order for your operation to end in the desired way in the long term, the necessary calculations and planning should be done before operations. Your operations should be performed in accordance with this plan.
What is revision nose aesthetic surgery?
What is the reason?
The reason why rinoplasty is among the most frequently revised surgical procedures is that the problem that occur on nose located in the middle of the face are thick or noticeable. Although the rates given about the rate occurrence of problem requiring repeated surgical applications after aesthetic nose surgery vary greatly. It is accepted that its rate is around 10%. There are various factors that cause undesirable results or problems after surgery. The most common of which are inability to fully identify problem before surgery, the patient's expectations are not fully understood, mistakes made in surgical technique, structural features of the patients, especially very thin and very thick skin or crooked nose, problem experienced during recovery period after surgery, especially trauma and infection, can be counted as.
What should the patient do in these cases?
Generally, we are postpone operations healing time. We have to wait minimal 1 year. 1 year if you need the revision surgery, we can make revision rinoplastie. It's important 6 months or 1 year we have to wait. And if you did the rinoplasty surgery, we can do revision surgery. If you need the additionally cartilage, we can take costal cartilage or auricular cartilage. We can take other body parts, other needs cartilages.
It sounds very scary, doctor.
Yeah.
No, it's not. It's not that much. It's not actually very because the doctors are explaining like the doctors, so that is why it's not actually very scary. It depends on the patient's needs actually. When in cases when there is different types of the surgeries, there is a mostly when the patient wants just to change the type of the nose. We don't use any kind of extra materials, but sometimes when the nose is were like damaged before in a huge way, sometimes this is what doctors were trying to explain, that we using the part of the bone from the body of the patient. It actually depends on the patient. It depends on what kind of trauma it was and stuff. So basically, it gives the patient the way to finally get the normal nose structure. So that is why this was doctor was explaining, that we have different type to change the people's nose.
Tell me, doctor, is there a perfect nose? How does it look?
Well, it looks totally perfect. Well, we need to understand one thing. We need to see how the patient was before, how his nose was before, and what his expectation. We need to understand that there is some kind of genetic and physical stuff which sometimes we cannot change. We need to understand that, and this is what doctor is explaining on the consultation very clearly to the patient. So we need to understand what we have and what the patient wants to have in the end. So, and
we'll see the images again.
And in this situation, doctor is explaining what he can do because, there is nothing impossible, but still we are not a God. So, of course, we're going to explain our patients very clearly what we can do and what we cannot to do. Exactly. Yes, this is a doctor's work.
Is this intervention done according to the structure of the face?
I'm sorry, we didn't hear you. Can you please repeat?
The rhinoplasty surgery is done according to the face of the patients?
Of course.
Yes,
patient?
exactly.
Of course, we need to understand that we need to understand the style of the face, the proportion of the face, the proportion of the eyes, eye head,
golden ratio.
Golden ratio is supposed to be, everything needs to be in the one way. So of course,
so that it fits well.
Of course, it's supposed to be look natural. This is the main work of our doctors, is to make it look naturally.
According to the patient face, we generally we can attention patient's facial ratio. The facial ratio is according to the golden ratio. Golden ratio is different patients and many people.
So it's changed to patient. So according to this
Yes.
ratio, we are trying to understand what is going to be the most the most perfect for exactly patient.
How does the rhinoplasty intervention affects the life of a patient physically and emotionally?
Generally, emotionally is many patients is improve, and additionally, healthy problem generally improve. Especially sinusitis and nasal obstructions is improve. Headache is generally decrease. Many people and
Nose problems create headaches.
yes, especially aesthetical problem and headache, both to solve this all problem.
I understand. Why should patients come to you, Dr. Ulu?
Because we are the best.
A sincere answer. You are the best.
We're the best, and Dr. Şahin Ulu is the best, so that is why.
Okay. Thank you very much for all this information.
Thank you.
Understand what you told us. Everything. You are the best. So who needs rinoplastie intervention should come there to Turkey, to Medical Göztepe Hospital, to Dr. Şahin Ulu. Right?
Exactly, exactly, exactly. We're going to be happy and glad to see you always in our hospital. Thank you.
Thank you very much. Have a nice day. It was a pleasure to talk to you.
Have a nice day. Thank you very much, Lisa. Bye-bye.
Bye-bye. Doamnelor, domnilor, vă mulțumesc foarte mult. A fost așadar domnul dr. Șahin Ulu. Domnia sa este specializat pe otorinolaringologie. Am vorbit astăzi despre ceea ce înseamnă intervenția de rinoplastie, de remodelare a nasului. Vă mulțumesc foarte mult că ne-ați fost din nou alături și vă aștept data viitoare. La revedere!